Well, acute cystitis is when the urine has quickly become infected with bacteria primarily, but again, less frequently with yeast. And a change in symptoms occurs suddenly over the course of a few hours or a day or two, where there could be urgency of urination, frequency of urination, burning with urination, and sometimes even a bloody
urethra inside of pediatric patients are really short, especially in females. In the female population, the urethra is very shorter than males, so females get more UTIs than guys. Especially in pediatrics here, your urethra is even smaller, and it's actually even closer to the anus, and this is where the bacteria comes from. So if you guys are taking notes, E. coli is a normal probiotic, or basically normal bacteria that is in the digestive system. Those are the good guys. They help you digest things. But when your good guys get into another area, like your urethra, it causes
There are several theories to explain how interstitial cystitis arises, but none of these have been proven. These theories include an infectious cause, a leaky bladder lining, so-called mast cell activation, an abnormal immune reaction, and a change in nerve cells of the bladder.
your patient's going to come in and say, hey, or the mom's going to say, my little girl has, very burning, very frequent pain when they pee. And it burns because we have the WBCs, white blood cells. And white blood cells are those policemen in our body. And they try to fight infection. The bad part is that when we pee, it hurts coming out of that urethra. And with the frequency of pee, your body's trying to get rid of this infection. So your body's trying to put as much fluid down through the urethra as possible. That's where we frequently pee a lot. We're going to take a urine sample. Does it stink? Does it smell? Is it very cloudy with all the WBCs, the white blood cells, making it cloudy? And we're going to, for the definitive diagnostic test, this will probably be on your test, so write this down, culture and sensitivity. We are taking a culture to see which kind of bacteria it is, and we're taking a sensitivity test, sensitivity meaning which antibiotic is it sensitive to? Which antibiotic will knock it out? And that is probably going to be on your test, if not the NCLEX. So write that down. Culture, which bacteria, sensitivity, which antibiotic.
A healthy pancreas releases a regular supply of insulin into your bloodstream. After you eat, your blood glucose levels rise, and your pancreas responds by releasing more insulin to move the glucose into your cells. Insulin acts as a key, opening up the cell so it can accept the glucose. In a person with type 1 diabetes, the pancreas produces little or no insulin. Without insulin, blood glucose levels By taking insulin as prescribed by your doctor and maintaining a healthy diet, you can keep your blood glucose levels within a healthy range.
To this device and tell it how much to give, either insulin to lower the sugar or glucagon to raise the sugar. So the old days of having to worry how much to do, especially when you go to bed at night. You know, one of the engineers who developed this has a child with type 1 diabetes who said, I'm afraid to go to sleep every night because I'm afraid my sugar will go